Georgia 041.
Clerk will report.
Amendment to the amendment in the nature of a substitute to H.R. 3281, offered by Mr. Carter of Georgia. Add at the end of
Without
Title.
objection, the reading of the amendment is dispensed with, and the gentleman from Georgia is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. Mr. Chairman, I'd like to offer this bipartisan amendment that I'm leading with Representative Lisa Blunt Rochester. Let me put into context how powerful PBMs have become. 3 PBMs control 80%, 8 out of 10 of all prescriptions processed in the United States. They own or are owned by insurers and have vertically consolidated their businesses to own everything and everyone between themselves and the patients, including doctors, pharmacies, group purchasing organizations, and more. Yet PBMs do nothing more than process claims. Paper pushers, I like to say. They bring no value to the healthcare system whatsoever. Now, I know pharmaceutical manufacturers need to do a better job with their pricing. I agree. I'll be the first one to admit that. But at least they put money back into research and development. PBMs don't put any money into research and development. All they do is pocket profits. That's why I urge my colleagues to support the Protecting Patients Against PBM Abuses Act. PBMs currently get compensated by charging fees calculated as a percentage of the cost of medicine. This incentivizes PBMs to push the price of medicines higher by blackmailing for formulary access. Blackmailing for formulary access. Telling a pharmaceutical manufacturer that unless you give us a rebate, we are not going to include your medication on our formulary. They choose higher priced medications to put on their formularies. They don't care how much it costs as long as they get a rebate. When PBMs have incentives to favor medicines with higher list prices, it can lead to higher costs for patients who face cost sharing and deductibles and coinsurance that is typically based on list price. It can also mean patients have fewer and higher cost choices when PBMs disfavor generic or lower priced brand competitors. Delaying action any longer results in increased costs for patients. My patients never ask me to dispense them a medication with the highest priced medicine. Why do the PBMs think that's what's best for patients? Because they're getting a higher rebate from it. That's why they do it. By delinking administrative fees paid to PBMs from the price of medicines, this proposal will help to correct this misaligned incentives and bring relief to patients to the pharmacy counter. Representative Lisa Blunt Rochester and I are proposing this bipartisan bill that will help patients afford their medicine and protect them from harmful PBM practices. There's no silver bullet to fix a system that's taken decades to get so convoluted and manipulated, but I greatly appreciate the work of this committee and so many of my colleagues to start to rein in these PBM tactics and put patients first. I understand that the Protecting Patients Against PBM Abuses Act is not on the agenda today, but I would like to work with the committee to ensure that it is ready for consideration at a future markup. Thank you, Mr. Chairman, and if anyone wants to comment, I'll be glad to yield.
Seeing no. It's your time, I'm sorry.